I wanted to kick off with a question that I had on my own, and that is, it sounds like the model, even, there were these 4 scenarios where you showed these sort of like curves, and it, even with the strict social distancing, you still see a resurgence of the disease sort of down the road, like closer to December. Those curves were still coming up later on. So do you mind going back to that slide? Just Sure. So everybody can visualize it.
This one?
Here. Yeah, so curves 3 and 4, right? So those are with the strict social distancing measures. Are those, I guess my question is around, what is the value of social distancing now if you're only going to see those peaks take place, but just at a later date?
Yeah, so that's a really great point. I guess one of the key values is that if you can delay it enough, you can give governments more time to respond. And something we also didn't mention is you can give researchers more time to start looking into different therapeutics, maybe start looking for vaccines. So that's one thing, is you get more time to prepare so that when it does eventually come around, you may have a better outcome because you are more prepared. But another probably an important assumption about this paper is that when that resurgence happens, they don't implement any new social distancing measures or any new kind of control measures, and so they just let things play out. But in reality, what would probably happen is that once you start to see an increase again, you may have governments that start to put more restrictions back in place just to try and keep things a little bit under control. Yeah.
Great, thank you. So I think that was a really important, buying time. I think is the key.
Yeah, that makes complete sense. Okay, and with that, I think we'll start going into some of the questions that our audience submitted, both through Zoom and Facebook. And we have a first question that was submitted by Rosalie here on Zoom. And she says that this feels that they're changing 2 variables at once by adding different types of SD, but changing times as well. Why not do one at a time and for the same amount of time before varying the time? Does that make sense?
Yeah, I think so. Here, for example, for curve 3 and 4, it's actually the same social distancing rules, but they implemented time by saying for this third case, we're going to stop at the end of March, and the other one is going to be at the end of April. So they actually, I don't know if it answers the question, but it's like for the same social distancing rules, but with a different time of the end of the social distancing rules.
So they don't change them at the same time, they change them in each group. So, the difference between 3, 2, 1 are the increasing amount of social distances, and then the difference between 3 and 4 is the time. They're not being changed at the same time.
Yeah, it's just, it's this slide that Sinead presented where it's the same social distancing rules, but one is just ending 1 month after the other. So if you compare those 2 scenarios, you're still comparing the same social distancing measures, but what happens if we keep it, we could do.
And between 2 and 3, for example, the time also did change a bit, or is that not true?
Yeah, so in between 2 and 3, they assume that we keep the social distancing measures 1 additional month, and we're even more strict by also adding this general social distancing. So it's true that in between 2 and 3, you're jumping a lot because you're adding 1 month of measures and they're even stricter.
Yeah, and I think that was the problem that Rosalie was alluding to, was that in that particular jump, you're actually changing a lot of variables at once.
Yeah, and actually what you can see from the results is by having more strict social distancing measure, here you see you decrease the value of the peak, so the number of infected people you're going to have at the peak. But if you just delay by 1 month, by keeping the same measures, you're going to have the same value of the peak, you're just delaying the peak.
Yeah, so the time just delays it, but the amount of social distancing measures reduces the number of cases. That makes sense.
Yeah.
And I also think it's worth noting that, you know, when we think about experimental evaluation in like a laboratory setting, it's a very controlled environment. When we talk about public health, none of our lives is happening in a controlled situation or in a vacuum. And I think that makes the data a little messy just inherently because of the fact that you can't control for, there's no control for human life, right? And so we all do what we're going to do. So I think, you know, for these types of data, it's tricky overall. Okay, so we have a question from Anissa. And the question is, what happens if people come out too early? And how does removing restrictions too early lead to more people dying or going back to phase 1, which I think might be quite sort of explained here in this but maybe you can go through it for Anissa.
Yeah, so once you release these restrictions is when, you know, people start moving about as normal again, and they can come into contact with each other just as much as they could before those rules were put in place. And so you have the contact rate among people starts increasing again, and like we showed, that means that the transmission rate will increase, and that's why you can get another increase in cases. So for example, the orange or the yellow lines here, the rules were taken out, and it did take a while for the cases to increase again, but you do see a few months later, you see that second wave because there's no more control measures in place.
Okay, great. And third question from Anne-Sophie, who is asking, eagle-eyed Anne-Sophie is asking why the curve with the strictest model looks initially higher than the others.
I'm not sure that it does.
Or just, no, I think initially higher, like before it goes down. I guess there's a little bleep there in January.
Oh, I see.
That's probably before the measures start getting put in place, but I don't know if Chloé, Sinead, you want to address that?
Yeah, so that's well spotted, but I think what's actually happening is it's more of a plotting issue. So I think the orange line and the yellow line are probably on top of each other, and what you're just the yellow line, because yeah, it's before the measures were in place, so everything's happening the same in those two scenarios. So it's just that you can't see the line below it.
Great, thanks. So Juan was wondering if we could elaborate on the impact of kids. So they had trouble understanding the logic behind why more cases would be averted if children, I guess if there was social distancing incorporated for schools and nurseries, but it's, I guess the assumption that Juan is making is that children are less infectious. Is that, maybe can you elaborate on that a little bit?
Yeah, so the assumption they make in the paper actually is that people who are symptomatic are less infectious, because they assume that if you have less symptoms, then you're less likely to transmit the disease, which may not be true, but that's an assumption that they make. And so they assume that because we haven't observed that many cases of children, then children are more likely to be asymptomatic, and so they're more likely to be less infectious. So that's what happens in this graph. And so you avoid more cases because you have less transmission, for example, occurring in the household. So by keeping people home, even if you close the school, you still have interactions between adults and children in the households. And if children are less infectious, then there's less diseases to the adults around them or the older children around them. So I think that's why they avoid more cases. And you can also avoid more cases in the older people because it's likely that sometimes, you know, children live with their grandparents or things like that. And so you can still avoid cases. And one thing that Sinead mentioned is that at the end of the social distancing, people go back to normal. So kids still go to school and you can still have transmission. So if children are less infectious, then this transmission in the school is less likely to happen, I guess.
Okay, I think we have a question now about your actual work from Lauren, who loves calculus and who's wondering if and how you use calculus in your work.
You wanna? Or I can say quickly. So basically, what we do is, or what I've done previously is, instead of looking at people, we look at cells. And so we use the same type of models, but we're looking at cells in your body. And for example, when you are infected by a virus, cells are acting in your body to react to the virus. And a lot of things are happening, and we could look at the dynamic of the cells the same way we can look at dynamics of people. And we're trying to understand those dynamics with mathematical models.
So I would agree completely with, I think Chloe described it really well. And just add that, you know, there's lots of options depending on what you're interested in. You can use very similar models to look at the spread of diseases. You can look at cells becoming infected. But you can also look at things like population growth. You can look at animal movements. There's so many different things that you can do with maths that I don't think I was really aware of until I left school and started studying it when I was older. So I think it's really great to be interested now. And there's lots of things you can do with it.
So adding on to Lauren's question, if a person is interested in maybe learning how to do this type of modeling, either because they just have an interest or maybe want to do this, you know, as an education and career, what types of maths do you think they should try to hone in on? Like, for example, is calculus more or less valuable than, say, statistics? You know, as people who come from those backgrounds in your training, what arm of math was sort of the most valuable for you?
For me, I have a background in mathematics, like basic mathematics. And then when I started trying to apply into health, I realized I really needed biostatistics and statistics. So I would not neglect that, but I'm a little bit biased because I have a PhD in biostatistics. So maybe I'm going to tell you that, but some other people will tell you something else. But I think it's great to have a first background in mathematics and be interested in biological health questions. There's always a way to find a master degree that does a little bit more applied mathematics, and then you'll find a lot of people who are interested in your skills to try and understand and help understanding biological mathematical skills, or bioinformatics, or, you know, even informatics is really useful. So keep going that direction.
Yeah, my background is in maths too, and I really wish I'd taken more statistics. But also computer coding is something that I think both Chloe and I use all the time. I probably do that more now than I use my actual maths knowledge. So if there's any way you can expose yourself to more computer coding, that's also a great skill to have.
It's so interesting that you're separating statistics from math, because
I was thinking the same.
I would consider them sort of statistics under the umbrella of math.
Exactly.
But are you saying that they're different?
Is it good to go into that debate? I don't.
Okay. We can talk about that later. But yeah, that's really interesting. All right, let's get back to the paper so that we make sure everybody's questions get answered. So here's a question from Peggy, and this is coming from Facebook, and it's around starting school in September. Do you think that, you know, when people are applying these models, I guess maybe for Wuhan or for even places in the United States like New York, do you think you know, opening up schools in September is going to impact any of this? What are the models saying?
I can start answering. I don't know, Sinead, if you have I think we need more information. Unfortunately, I don't think we can project now. That's actually why the Columbia team is only projecting like in 8 weeks, because a lot of things are changing, whether it be the behavior of people or the policies or like a lot of things. So we need more information. We also need more information on how many people are actually infected in the country or in New York City. So we need more testing, and that will also give us a better idea of, you know, how much the disease has spread in the city yet. And based on this information, maybe we can reevaluate for the situation in September, but I definitely like it's too early to answer that question.
Okay, all right. We'll move on to the next one then. And this is a little bit outside of the scope of this paper, but I still think we can discuss this from Aileen, who, you know, in your model, did different conditions that people could have in the model that was discussed. You mentioned that people were not infectious once they had recovered. And Aileen was wondering if that had been determined, because she thought it was unknown.
So it's very true because I would say it's unknown how long people are infectious for. So, you know, the model, they assume it's on average about a week, but it could go up to maybe 2 weeks. That's still definitely unknown. But the idea that, you know, the way we define recovered is that you're no longer infected and infectious. So the definition of recovered would say that, you know, once you are in that recovered phase, you are definitely not going to transmit the disease anymore. But she's absolutely right. It's unknown at what point you will move into that stage after you've been infected and become infectious. Yeah.
And obviously then a different question is, can people at that point become infected again? But I don't think that that was really included in the models that we were discussing. That's, you know, a question for another paper.
Also, for that question, I would refer to the previous D4P that was speaking about
exactly.
how long immunity lasts. And that's also something that can be included in the model when we know more. We can also assume that, you know, proportion of the population is likely to be reinfected if it's the case or not, and that can be adjusted in the model. But if you want to know more, go just watch the D4P from last week.
Mm-hmm.
Well, luckily that page is live, so people can watch it and engage with the discussion guide. So we can share that with everybody here. Okay, so we have another question from Lauren. And I guess this is getting at the seasonal spread. So how does the virus spread differently when you're inside versus outside? For instance, can people spending less time inside in the summer months prevent the virus from spreading so quickly? If you know.
So I am not an expert. I think a lot of it depends on what happens to the virus in the air once, you know, somebody coughs or sneezes and how the particles kind of disperse. But I think the general consensus or thought at the moment is that being outside is, you know, you may be less at risk because, you know, particles have more space to diffuse. But yeah, it's not my area of expertise, so I wouldn't be able to say definitively.
Yeah, that's a very tough one to answer. But, you know, I guess there's still research ongoing around all of this. But did they, no, correct me if I'm wrong, but they did determine when SARS or MERS first came out, were those seasonal by any chance?
So I think at least for SARS, it wasn't around long enough for us to tell. But so there are other human coronaviruses that actually circulate year round. They're related to the novel coronavirus, but they're the second leading cause of the common cold. So we've probably all had them a lot, and those are seasonal, and there are higher numbers of cases in the wintertime. But it's, so it could be that the new SARS-CoV-2 is like that, but we just don't have enough information to tell right now.
Yeah. So it seems like we lost Chloé, but I think because the only reason is I was going to suggest we go back to the slide where you had the graphs for the next question, but I think we can probably all remember it. And the question is from Aaron. And he's saying that the maximum difference between the peak heights when you compare scenario 1 with scenario 4 is about 20% or less, and that the total area under each curve, which is a concept that you might want to talk about as well, appears to be about the same. So he thinks that this suggests that if, assuming no effective treatment is developed by December, the total number of deaths is similar regardless of social distancing.
So they don't share those exact numbers in the paper of what the total number of infections is. And so, yeah, maybe I should go into the total area under the curve in those graphs. So what each curve is plotting is the number of new cases each day. But if you were to add up the number of cases on each day for the whole length of the time, then that would be the total number of cases that you get over the whole period that they're looking at. And so that's essentially what the area under the curve is like all those cases added up together. And so they may be very similar. I think in the paper they plot the total number, and they, at December 2020, right at the end when they stopped their simulations, there is a very slight difference between some of the curves, but it's not that big. And so, yeah, what that suggests is that the total number of cases, there isn't much difference between the scenarios. But, I think the main point is that, even if that is the case, it's really important to delay that peak, because if you give people more time to prepare, it may be that in a couple months' time, you found a therapeutic, or your hospitals are more prepared, so you can actually have a better impact when those peaks start. And so you may actually be able to push down that peak more than it is portrayed at the moment, assuming that, everything is the same.
Yeah, exactly. And the maximum number of cases in one day being slightly lower is obviously going to make a big difference in the, hospital capacity for that day.
And as we sort of described before, those peaks are taking place at a much later date. So the hope is that there's just more time for
To prepare.
creative intervention. Yeah. I love this question from Sophia, and the question is around, can researchers use data from the study to map deaths due to COVID-19 over time? So what would be required to clarify the importance of social distancing in these models?
Sorry, is it about the data that we need to gather, or is it more about?
Yeah, I guess it would be, I think it, we're in such early stages of understanding the impacts of social distancing, right? So what would help clarify what extra data or, variables are needed to really understand how social distancing is impacting the spread of COVID-19?
Yeah, so I think we've been speaking a lot about testing in the population, because now at the moment, the observation we have about the people who are infected is mostly through people who are going to the hospital. So it's definitely useful to have a better idea of how many people are infected in the population to better understand how the virus has been spreading in the population. I think what some people have been saying is that we don't have a control because we don't know what's happening when the disease, spread if we don't do the social distancing. But we have seen that countries who haven't applied social distancing have been having some issues, which is definitely not a control compared to like what's happening in New York, for example, but it gives us insights on also the dynamic of the epidemic. And also this social distancing stuff is something that we would apply for any other disease that's transmitted by air. It's not just specific to COVID-19, it's measures that are being recommended by experts for a long time. I don't know if Sinead has something to ask, but.
No, I think, yeah.
Yeah, cool.
Right. So this is a really interesting question by a DT. So, okay, if individuals are easily reinfected with the virus, and as we've mentioned, that's a big if, and again, directing people to last week's presentation. Thank you, Lizzie, for sharing the link for that. But let's imagine, hypothetically, that if individuals were easily reinfected with this virus, and they could then be infectious again, how would this affect the R0 value and the peak of the curve? Is that something that could be included in the modeling?
Yeah, so, sorry, go ahead, Sinead.
On you go, Chloé.
So the R0 is not going to be affected. The R0 is what happens if the disease spread in a population that's completely susceptible. So it's something that you would determine mostly at the beginning of the epidemic. The effective reproductive number, the RE or RT or R that Sinead mentioned would definitely be affected because people would just be like, instead of being recovered and not being able to not being reinfected, they will go back to the susceptible compartment. And so that would definitely affect the progression of the epidemic. Yes, it would increase actually the progression of the epidemic. And we would need a vaccine or a treatment to prevent that.
So I'll ask the last question, and I'm just going to sort of summarize a couple of the ideas that I see in our question chat, and it's around the motion to, there's a lot of states that are currently reopening, and what we're finding is, some of the states that are currently reopening didn't necessarily have very strict social distancing rules in the first place, and that could be for a variety of different reasons. And as they reopen, we're also seeing things like, everybody's going to the beach or everybody's going to a restaurant. What do you think that's going to do? What do you think that, do you think that, are there models that can help people sort of understand the consequences of those actions in these like granular ways? And if so, how is that kind of information important for policymakers to know and sort of Congress people to know? Where do you see those intersections of the modeling pieces and the people who are making the rules for society? I know that's a little bit of a loaded question, but I would love to hear your thoughts on that.
So personally, I'm a little bit worried about places opening up too soon, because it's cases may look like they're kind of steady now, but there's always a lag between when things are implemented and then when we actually start to see cases turn up at the hospital because of the long period between when you start to show symptoms. And so what may look like is, things are going okay right now. It could be that in a few weeks' time, it's a different story. Sorry, I forgot the rest of the question.
Just like, how are people engaging with, like, are people like in your field, for example, or your lab group as an example, are they engaging with policymakers or people that are sort of getting to say how people behave in a society or community?
I would say that I'm sure people who are modeling these things are trying to engage with policymakers and people at the government level to try and help plan, or at least I'm sure people are communicating the results of their model, but then it's up to policymakers whether they want to implement kind of the recommendations of the scientists, because obviously there are a lot of other factors that go into these decisions, and economic factors and lots of other factors. So yeah,
I imagine it's very tricky. Yeah, sorry, go ahead, Chloe.
No, I was just going to say that we've seen decisions that were based on models. Like a couple of months ago in UK, some decisions were taken after the results from a model were published or spread. So it's actually already happening, which is good that government are taking decisions that are based on science. And again, as we said, the models are going to be refined by more data, and because we're learning more about the disease. So hopefully it will help also in the future to take also decisions that are balanced between the other factors and the number of people kind of affected by the disease.
Yeah, thank you. And I think with that, I think if anybody's really interested in science, but also interested in public health and or policy, I hope everybody out here will consider, moving in those, like training in science and then being a part of the government. I mean, how amazing could it be to seed our government with people who value data and the scientific